Hello everyone, welcome to the channel, and today I'll discuss about the diseases of ear. Now, first one is acoustic neuroma. In this case, there is a formation of non-cancerous growth which begins in the nerve that carries the hearing and balance sensation from the ear to the brain, and eventually this tumor fills the ear canal, and if left untreated, it can lead to life-threatening damage to the brainstem. The optimal treatment here is to remove it surgically. Next is cholesteatoma. So, cholesteatoma is an abnormal cyst or pouch in the middle ear which is usually caused by repeated infections. Over time, a cholesteatoma can cause deafness and even life-threatening complications. The treatment options for cholesteatoma involve surgery to remove the cyst and infection, followed by 6 to 12 months later by an operation to check for any residual cholesteatoma, to reconstruct the middle ear and to restore the hearing if it is possible. Next is mastoiditis. So, it is an infection of the mastoid bone. Mastoid bone is a honeycomb type structure that is part of the skull, our skull, which is behind the ear. And if it is unchecked or untreated, mastoiditis can lead to deafness and even life-threatening complications. The first line of defense or treatment may be use of antibiotics, but mastoidectomy may be required to clean out the infection, and if necessary, tympanoplasty to repair the damage of the eardrum. Next is Meniere's disease. Meniere's disease. It is a disorder of the inner ear which is characterized by dizziness, loss of hearing, and ringing noises in the ear. This is mainly caused by an imbalance of fluid in the inner ear and is thought to be an immune or inflammatory response. So, here the immune system is involved. The condition usually treated with medications, but when medication does not work, in that case the only option is to have a surgery to relieve pressure in the ear, remove a faulty balance organ, that is the labyrinth, or partially or complete removal of a balance or hearing nerve. Next is chronic otitis media. It is an ongoing infection or inflammation of the middle ear that is usually affecting the children. A persistent condition can lead to hearing loss and even other serious complications. Treatment options include surgery called a tympanoplasty to repair the eardrum and hearing bones. This procedure is sometimes combined with mastoidectomy to remove the diseased tissue. Another procedure is tympanoplasty, which involves inserting a small metal or plastic tube in the affected ear to ventilate it, to supply air or ventilation and prevent buildup of extra pressure and fluid. Next is otosclerosis. Otosclerosis. So, otosclerosis is a condition that is characterized by abnormal bone growth in the middle of the ear or middle ear, which limits the transmission of sound vibration through the ear, and if it is left untreated, this condition may lead to total deafness. The surgical option is a stapedectomy. Stapedectomy means in which the stapes or the one of the ossicle bones which is spongy in nature and which is present in the middle ear is replaced with a prosthesis that transmits the sound waves to the inner portion of the ear. So, these are about the diseases of the ear, and here I am ending my today's video, and if you guys like my videos, please subscribe the channel. Thanks for watching.